Hello everyone. So continuing with the revision series, today we will be doing oncology. Today will be the part 1 video. Okay, in this part 1 we will study about the cervical cancer cervix screening. Okay, because a lot of question comes from screening itself. So in part 1 only we are going to do the screening of the cancer cervix, and in the part 2 we will do rest of the oncology. Okay, so let's start it. Cancers in general. First of all question is, which is the most common cancer in female? Okay, when I'm asking you, or in the exam question comes, which is the most common cancer in female, sorry, your answer will be whichever is the most common cancer in India. Okay, when it is specifically written which is the most common cancer in world or in the western country, then you have to give their data. When it is written which is most common cancer in female, you have to tell the data of India, needless to mention in India. Okay, which is the most common cancer of female in India? Yes everyone, CA breast. Yes, it is CA breast. Okay, which is the second most common cancer? CA-CERVIX. Do you know how common CA-CERVIX is? Okay, if there are 100 females, not the females of reproductive age group, okay, from all the females, 100 females, newborn females, adult females, all the females, out of every 100 female, one patient is dying due to cancer cervix. This cancer cervix is so much common in India. That is why lot of questions are coming on screening, and a proper protocol is there for the screening of cancer cervix, and lot of questions are coming on cancer cervix screening. That is why we have separately taken this topic. So it is so common. Okay, okay, okay. Which is the most common genital cancer in India? Cancer cervix, of course, right? Okay, in females. Okay, which is the most common cause of postmenopausal bleeding? It is again cancer cervix, because in India cancer cervix is so common. Okay, which is the second most common cause of postmenopausal bleeding? It is endometrial atrophy. It is endometrial atrophy. Okay, most common cause of postcoital bleeding? It is again CA-CERVIX. Okay, most common cause of postmenopausal bleeding in the world? It is endometrial atrophy. Okay, so now you can clearly see that then in India the most common cause of postmenopausal bleeding is CA-CERVIX, because CA-CERVIX is so common. Okay, most common tumor, now they are not asking cancer, they have changed the term to tumor. Most common tumor in the whole world or in India, the answer is same. It is fibroid, or our favorite another name of it is myoma or leiomyoma. Okay, okay, next question is from the as you all know, this class is totally dedicated for the screening. Okay, and CA-CERVIX is caused by HPV virus. Okay, so government has bound us doctors to do a screening in each and every lady of 21 to 65 years. What is the age of CA-CERVIX? 21 to 65 years. So we have to screen each and every lady, because CA-CERVIX is so common in India. We as gynecologists or the health workers of related to gynae department or government health workers, we are bound to screen every female from 21 to 65. we have to ask that female that you should get screened. These are the tests. Okay, so we should and we all know that HPV virus is causes CA-CERVIX, and we have developed a vaccine. Okay, so first concept which you all must be having, and if who are not having, make it now, that screening is done in a healthy person. Okay, the person who does not have any sign and symptom. And cervical cancer screening or cancer cervix is done in the whole female, in all females who are in 21 to 65 years. If any female is having symptoms or any sign of cervical cancer, we are going to study all those later, then we will do confirmatory test, then we are not going to do screening test. So okay, now I'm asking to screen a lady, I'm asking you to screen this lady. It means that lady is having no symptoms of cancer cervix, that lady is a perfectly normal lady. And if this any lady is having the symptoms, then we will do the confirmatory test. Okay, now let's do it. What is the causative agent for cancer cervix? You all know cancer cervix is caused by human papilloma virus. Okay, and human papilloma virus has more than 100 serotypes. More than 100 serotypes are there of human papilloma virus. They are broadly divided into two types. One type is low risk type, which mainly cause genital warts. And these genital warts, they are known as condylioma acuminata. Okay, and it which two types are there? 6 and 11. Okay, what is the number of that serotype? 6 and 11. Now the another type is high risk type. The high risk type contains those which cause cancer cervix, mainly cause cancer cervix, and it contains which two types? 16 and 18. Okay, so now they have caused which of this serotype is causing cancer cervix or CIN3. So have you seen that CIN3 is or cancer cervix is caused by high risk type, and those viruses are 16 and 18. So answer will be HPV 18. Okay, now see which of the following is caused by low risk type. So we have seen that low risk type, if it contains the serotype 6 and 11, and it causes genital warts or condylioma acuminata. Okay, now you should know that in addition to this genital warts, they are causing one more problem, and that is one more disease is larynx or laryngeal papillomatosis. That was what was asked in INSIT MI 22. Which of the following is caused by low risk type? So the answer is laryngeal papillomatosis, because you know that high risk type cause cervical cancer. Now let's study what are the other cancers or other problems caused by high risk type. High risk type mainly contains 16 and 18. So, and it causes cervical cancer. What other cancers? What is below cervix? Vagina. Vaginal cancer. What other? Vulval cancer. Below vagina is vulva. then anal cancer, then male penile cancer, okay, then it can also cause oropharyngeal cancer. Other than this high risk can also cause sometimes it can also cause genital warts, sometimes, rarely. And similarly, this low risk can also cause cervical cancer, rarely. ठीक है, rarely. So high risk cancer, other than causing cervical cancer, it also causes vaginal, vulval, anal in the male, penile cancer, and oropharyngeal cancer. So if you see the cervical cancer, anal cancer, and oropharyngeal cancer, these all the three cancers are caused by the high risk type. And whereas the low risk type, it causes is mainly causes less malignant, or less disease, less morbidity disease. Okay. Now this is again question from the May June exams. Lady with warts was found to have a HPV of high risk type. Lady came with the genital warts, and when the biopsy was sent, it was found that the lady has a HPV, human papilloma virus of high risk type. Which virus serotype it is? Which serotype it is? So question is which serotype? Okay. So high risk type contains 2, 16 and 18. So the answer is 18. Okay. Now we have seen that already studied that more than 100 serotypes and broadly divided into low risk and high risk. Now this HPV virus has two types of genes. Okay, they are known as E gene, which means early genes, and another is L gene, which means late gene. Okay, and out of this E gene, this E6 and E7, they are responsible for malignant transformation. Okay, they are responsible for malignant transformation. And L1 gene, it codes for capsid protein. Capsid protein. What is capsid protein? See, if this is the virus, then these external proteins or the external coverings are known as capsid proteins. This are the proteins by which the virus does adhesion to the cervical cell. With the help of these capsid proteins, the virus adhere to the cervix cell. Okay. Now in the vaccination, we target these genes. When we are vaccinating, we target these genes. Vaccination, we target L1 gene. We target L1 gene. No adhesion, no further processing. And E6 and E7, they are responsible for malignant transformation. Okay. Now let us see. As per WHO SAGE guidelines, the recommended dose of HPV vaccine in 9 to 14-year girls is, you all know we have human papilloma virus vaccine, right? And we have human papilloma virus vaccine, and we have three types of vaccine that we are going to discuss later. First, if we are giving, the age in which that vaccine is given is 9 to 45 years. If the female is of age 9 to 14 years, then we give only 2 doses. Okay, at 0 dose, or and the second dose is at 5 to 6 month. Okay, if the lady is or female is more than 14 years, then we give 3 doses. 0 dose second month, and next is 6 month. Okay, now they have added as per WHO SAGE guideline. Okay, so WHO find that there are a lot of females who take 1 dose and they didn't come back, and they didn't come back for the other dose. ठीक है, WHO SAGE find it that the immunity of both the females who have taken 1 dose and who have taken 2 dose was comparable. So WHO SAGE guidelines which came in March 22, recently only, they said even if the female is taking 1 dose or 2 dose, their efficacy is comparable. So, one or two, both is the answer here. Okay, let's see now the different vaccines. There are 3 types of vaccines: CERVIX, Gardasil, and nonavalent. And this nonavalent, we will discuss it. CERVIX is also known as bivalent vaccine, and it is against 2, bi means 2 serotypes, 16 and 18, the most high risk types. The Gardasil is quadrivalent, and it is against 4 viruses, 4 serotypes, sorry, 6, 11, 16 and 18. The nonavalent, which is also known as Gardasil 9, it is against 9. It includes this 4, and it is also against 31, 33, 35, 52, 58. Okay, the nonavalent is against 9 serotypes. 6, 11, 16, 18 are there in nonavalent. I will write it here so that you don't think nonavalent is not against this. 6, 11, 16, 18 is there here, and it is also against 31, 33, 35, 52 and 58. Okay, now next is the to learn this, you know that 1, 3, 5, if these are the odd number, 2 and 8 are the even number. Okay, true about vaccination is all except. Now let's take this question. Does not require further pap smear. Do you think it does not require further pap smear? This statement is false, because we have seen that vaccination is only against 9 serotypes. CA-CERVIX can be caused by other serotypes too. Okay, true about vaccination is all except, it means you have to tell false. This statement is itself false. What if that the female who has taken vaccine got the CA-CERVIX from other serotypes? So we should get the screening of that female done even after vaccination, because other serotypes can infect. Can be, now the second statement is can be taken with other live viral vaccine. Yes, it can be taken. Next option is bivalent is less efficient than quadrivalent. Yes, bivalent covers only 2 serotypes and quadrivalent covers 4 serotypes. So bivalent is less efficient. Administered on 0, 2 and 6 month. Okay, yes, it is administered on 0, 2 and 6 month. So first statement is the false statement. Transformation zone. What is transformation zone? Zone between the old and the new squamocolumnar junction. Let me explain you this. See, this is endocervix and this is ectocervix. Okay, and this is your uterus, right? Let me draw the ectocervix with the another color. This is the ectocervix, which is outside, and this one is the red color is the endocervix. Okay, this one is the endocervix. Okay, this one is the endocervix and this one is the ectocervix. Okay, now the endocervix is lined by columnar epithelium, and this ectocervix is lined by squamous epithelium. Okay, now when puberty comes and body is exposed to estrogen, cervical cells are too exposed to estrogen. Now this endocervix, it pouts out. Okay, now let's see. You know that this is a transverse section. The other diagram was of the vertical section. Now this is a transverse section of the cervix. So what we are seeing is, of course, ectocervix, right? Now what happens when puberty is there? The endocervix, it pouts out. See, endocervix come out under the influence of estrogen. Okay, now if this was endocervix, so now this has come out. Now here on the ectocervix, endocervix comes out. Okay, after a certain period, this endocervix, which has columnar epithelium and has pout out, now is covered by the squamous epithelium due to metaplasia. Okay, is covered by the like this. It is covered by the squamous epithelium. Okay, now if I tell you ki, which was the older squamocolumnar junction, what you will say? Older squamocolumnar junction was here and older squamocolumnar junction was here. Okay, here, and the new squamocolumnar junction is here. So this area which has transformed, in which the metaplasia has occurred, is the transformation zone. Okay, and this is a very dynamic zone. Metaplasia has occurred. Now there are high chances that human papilloma virus will in this area is prone to HPV infection. Okay, HPV attacks at this area. That is why questions come on transformation zone. Okay, transformation zone questions come. Okay, now see what is the question. It's the site where HPV caused dysplasia. Yes, it's true. It is a dynamic zone where metaplasia has already occurred. This is true. It is found when columnar epithelium of the endocervix pouts out due to estrogen exposure and then is covered by squamous epithelium. This is also true. So answer is all. Now we will study the screening procedure. After studying the HPV virus, vaccinations, now we will study the screening. Okay, how we are going to screen the general population from this cancer and how we will prevent this. Okay, one thing I would like to tell you, due to this screening, due to this pap smear screening, CA-CERVIX was the first most common cancer in Indian females. Now it has become the second most common cancer due to this screening. So you will see how efficiently we can and catch the cancer cervix in the common population, general population. What is the order in which pap smear is taken? Now here I will tell you how the pap smear is done. Okay, first I would like to tell you ki you have to see in the camera my hands. Okay, actually I was trying to enlarge the camera. Let me see if I can do it. Yeah, I'm able to see now. This is you think this is vagina. So first step which we are going to see, this opening is vagina. The first step which you will do is you will retract the vagina with the vaginal wall retractor. Okay, you will retract the vagina with the vaginal wall retractor. So first step is retraction. In this question we have lot of steps. So first step is we will retract. Okay, we have to arrange this step which is given in the question. So let's first see. We will retract the vagina with the vaginal wall retractor. Okay, and it is retracted by Cusco's scapulum. Those who don't know what is Cusco's speculum can go to my Telegram channel and see, we have done the questions on there. Then second is we will take the air spatula and we will scrap the cervix. Inside the vagina there is cervix, so we will scrap the cervix. Second step is get that cells or scrap the cervix and get the cervix cells. Third step is we will spread those cells that we have taken on air spatula. We will spread those cells on the slide. Now this is slide. We will spread those slide on the side. Third step is preparing the slide, or we can say preparing the pap smear. Fourth step is, as soon as we have spread those cells on the slide, we will spray the fixative, and the fixative contains 95% and 95%. Yes, and the fixative contains 95% ethanol. Okay, fixative contains 95% ethanol. Okay. So first step is insert the vaginal wall retractor. Second step is scrap the cervix. Third step is prepare the slide. And the fourth is fix the slide. And the fixative is 95% and ethanol and or ethyl alcohol. And then we are going to send those slide to the pathologist. Okay, then we are going to send those slide to the pathologist. Which statement is not true about CA-CERVIX screening guideline as per WHO? Okay, pap smear. Now, what is the CA-CERVIX WHO guideline? Okay, that it is to be done. I have told you earlier also that it is to be done in 21 to 65 years female. Okay, next is that at in the age group after 29-year female, it is good. Sorry, first you should know when it is repeated. Okay, when it is repeated, it is to be repeated it after every 3 year. Every 3 year. So this first statement is false, that it is to be repeated yearly. Okay, it is to repeat it every 3 yearly. The another statement which the guideline WHO says, in the women who are more than 29 years, instead of repeating this pap smear every 3 years, it is good if the women get their HPV DNA simultaneously with pap smear, and then they can repeat it every 5 years. But as you know, HPV DNA is a costly procedure. If one cannot afford, then continue getting pap smear every 3 years. Okay. Okay. Pap smear repeated less frequently if it is negative. Yes. So pap smear, if you will find, we will study that if pap smear is coming positive, then we will repeat it very early. Okay. Via is more, visual inspection is more reliable in old age as transformation zone is more exposed and clear. You know, the transformation zone comes out due to estrogen. So more age, more estrogen exposure, and more is the transformation zone pouting out, endocervix pouting out. So fourth statement is also clear. So this is wrong. Pap smear repeated every 3 yearly. Pap smear is repeated every 3 yearly. All are true about PEP except. Next question. Avoid local antibiotic lubricant. I have explained you the whole procedure. Nowhere I told you that you will nowhere I told you that you will apply antibiotic or lubricant. I don't tell you. Okay, so this is false. Next is proper exposure of cervix is must. Yes, proper exposure of cervix is, sorry, first statement was avoid. Yes, first statement is true. Second statement is proper exposure of cervix is must. Yes, proper exposure of cervix is must. Okay. Third statement is fixative is 95% ethynyl alcohol. Yes, fixative is 95% ethynyl alcohol. And the fourth statement is smear should be fixed after drying the slide. No, I told you as soon as you prepare the slide, you spray the fixative. No air drying. So, no air drying. So, fourth statement is false. Okay. Next is, see, this is the picture of Copland's jar. Please don't confuse this jar with liquid cytology. Okay. This is the liquid cytology bottle and it contains it is just like urine vial. Okay. This is Copland jar. It was seen that when those slides which we made from pap smear, they were transported, sometimes they broke up. So this jar, it already contains fixative. So we just need to put the slides in this jar and it already has fixative and we can transport the slide without breaking. So this is a picture of Copland's jar. Okay. Next is pap smear report test. What will the pap smear test report tell? It will tell on the pap smear report there are 6 findings. Number 1 is ascus, number 2 is CIN1, number 3 is CIN2, number 4 is CIN3, number 5 is CIS, number 6 is invasive cancer. Okay. What is ascus? Ascus means atypical cell of undetermined significance. And CIN1 means if this is the slide which we sent and these are the cells which was there on the slide and then Pappenkilos stain was done. Okay. So atypical cell means nothing was interpreted. Okay. And what is CIN1? CIN1 means that CIN1 means 1/3 of the cells were malignant or have dysplasia. What do you mean by dysplasia? Dysplasia means large nucleus, only 1/3. Then it is CIN1. If up to 2/3, 1/3 to 2/3, then it is are dysplasia, are having large nucleus. Then it is CIN2. This is CIN1, this is CIN2, and if more than 2/3, it is CIN3. If it is more than 2/3, if all the cells are dysplasia, then it is CIS, okay, in C2. Okay, so in the K, and what is invasive cancer? If the dysplasia cell have crossed the basement membrane, has breached the basement membrane, then it is invasive cancer. So what is the treatment of pap smear? So what is happening? A normal lady has come, okay, and we have screened that lady, and these 6 reports come. Either it can also come normal, no dysplasia found, or they can come 6 reports. So if the report is ascus or CIN1, then we are going to repeat the PEP at 6 months, and we are also going to get the HPV DNA. In rest all of the reports, we are going to get colposcopy biopsy done. In rest all of the reports, we are going to get colposcopy biopsy done. The other methods which are for the screening are pap smear is the one method. Via, what is via? As you have seen that pap smear requires gynecologist, pap smear require pathologist, and pap smear require apparatus, air spatula, vaginal wall retractor, Coplin's jar, slides, fixative. So lot of cost is there. Mainly the cost of gynecologist and pathologist. So government has given us a cost, less cost procedure, that is via. Via is done by nurses. And what is done via? This is the transverse section. We apply on the acto-cervix, or on the transformation zone, we apply the acetic acid. And if there is rapidly proliferating cells, then these acid cells will, this rapidly proliferating cells, because they have large proteins, they will convert these cells will get and convert into white, get change into white, okay, will become white. If as there are aceto white, means these joina suspicious. So this is the cost effective screening. So question was there in FMG, most cost effective screening of cancer cervix is via, because in via we are just examining the cervix in bulb light. No pathologist is required and no gynecologist is required. It is done by nurses. No colposcope is required. Just under the bulb light, we are applying the acetic acid and we are noting the white area. Okay. So that was all about the cervical cancer screening. Hope your all the queries got cleared. See you soon in Oncology Part 2. Thank you.